Dr. Cameron Edgar from Edgar Family Chiropractic. In this video, we're going to talk about a common condition we see in the clinic called sciatic pain. So sciatic pain is just a general umbrella term that people will use to describe pain from their back and pain coming down their leg, usually affecting the sciatic nerve. So there's lots of different reasons why that sciatic nerve can become affected. So it can be affected by the discs in the low back that are putting pressure on the nerve that comes down the leg. It can also be affected by what's called your sacroiliac joint or your pelvis. When that joint's not moving well, if it's irritated, it can also put pressure on the nerve. And then on top of that, we also have some of the muscles in the buttock or the glute region, some of those hip rotators that can squeeze or put pressure on that nerve. So our job is to figure out which one of these or combination of these things are the culprit, and then to get at treating that. Most of the people who come in for sciatic, a lot of them tend to be more sedentary, sitting lots for work, putting pressure in that pelvis and hip area. But it can also come from people who are more active and have repetitive strain injuries as well. Some of the modalities that we use to treat this, we want to free up these muscles that are putting pressure on the nerve, so we get in with our hands, work on the muscles. We also want to get the joints moving better or decrease the amount of pressure on the disc if that's the problem. So doing things like traction or stretching, mobilizing the joint, getting better motion. We also can reduce the inflammation or the tightness around that nerve, that sciatic nerve. So things like ultrasound, electrical stimulation, heat, acupuncture, all this can work to do that. And a large part of the component of treatment also comes at home with the patient doing things like stretches or exercises to loosen up the area, get better mobility, and then even strengthen the area so that we don't have future problems in the same spot.